Good afternoon, everyone, and welcome to our webinar entitled Writing Effective Medical Summary Reports. Just a quick disclaimer, the views, opinions, and content expressed in this presentation do not necessarily reflect the views, opinions, or policies of the Center for Mental Health Services, the Substance Abuse and Mental Health Services Administration, or the U.S. Department of Health and Human Services. So some webinar instructions. The slides and materials for today are available on the SOAR website, in addition to the registration link and some of the reminder emails that you receive from Zoom. We'll also put the link in the chat so you can access the slides there as well. This webinar is recorded and it will be available within a week at the above SOAR website link. Audio and chat, the participant lines will be muted and the chat feature disabled. Questions, you'll be able to ask questions using the Q&A feature, and we do have time at the end of the webinar for our general Q&A response. Today we were lucky to have ASL interpretation by Pamela and Stacy and live captioning services from Leora. So they'll be provided for you today. To show the captions, you can click the CC icon, or you can also, click the presenter video with the three dots at the top right to access the ASL video. So an evaluation is followed at the end of the webinar. So your browser will redirect you to the survey. We ask you to complete the evaluation. So doing today's welcome, we are lucky to have Michelle Gleason, who is the SOAR ACOR with SAMHSA. Michelle?
Thank you, Pam, and a very warm welcome to all of you. And thank you for joining us today. I was watching the numbers just go up, up, up. This is really a well-attended webinar. On behalf of the Substance Abuse and Mental Health Services Administration, I would like to welcome you to the SOAR webinar titled Writing Effective Medical Summary Reports. This webinar will guide you through writing effective medical summary reports, or MSRs for short. MSRs are a SOAR critical component. Research and data show that including an MSR with a SOAR assisted application leads to higher approval rates. Staff from the SOAR TA Center will share tips and tools for writing effective MSRs and answer your frequently asked questions. I would like to welcome and thank our panelists from the SOAR TA Center for your willingness to share your expertise on this important topic this afternoon. And Pam, I'm going to turn it back over to you. Pam will be moderating today's webinar. Thank you, everybody.
Thanks, Michelle, for your support. So to help us reach our objectives, and by the end of the webinar, we hope that you'll really learn more about how MSRs are a SOAR critical component and why they're a SOAR critical component. You'll also learn how to apply some best practices and strategies to help make your MSRs the best that they can be, and also to make sure that they're included as part of a complete SOAR application, and understand, how to utilize some of the tools and resources that we've developed here at the SAMHSA SOAR TA Center to really help you, write effective MSRs. So to help us get there, we have a complete panel made up entirely of SOAR TA Center staff. So we have Kristen, our project director, Dazara and Abby, who are assistant directors, and Amanda and myself. We'll be answering your questions, and some will be doing more deep dive in certain sections of the MSR. So to kick things off, we have Abby, who is going to provide an MSR overview for us.
All right, thanks, Pam. And so excited to be here and talk to you guys about the medical summary report and how important and impactful it is to the overall SOAR application. So the medical summary report, what is it? Now, counter to its name, it is not necessarily only a summary of the medical evidence, but rather a medical summary report is a letter. It is a letter, it is a narrative that you write that describes the applicant's diagnoses and how their diagnoses affects their ability to function and work. It is also going to paint that complete picture of the applicant. You're going to tell their story, whether it be about their personal history or legal history, or perhaps about their substance use, and really detailing how their functioning is affected by those diagnoses that they have. So this medical summary report It'll oftentimes take the place of the SSA 3373 or the adult function report. Not always, but even if you do need to fill out that function report, the MSR is going to be a great addition. It's going to be a great companion to that functional report. And then if and when the medical summary report is signed by an acceptable medical source, it is going to be weighted more heavily and be elevated to be considered medical evidence by the Social Security Administration and DDS. But overall, the MSR is really answering that question: can a person work and can they earn that substantial gainful activity? Now, we have a number of resources on the SOARworks website that will aid you in writing this medical summary report. But the number one thing that you want to be using when you are learning to write a medical summary report, and especially as you're doing multiples of them, is the medical summary report interview guide and template. This is both a template that you can write your medical summary report into, but it's also a number of pages that talk about the expectations for each section of the MSR. So it has many open-ended questions. Tell me about how often, when was the last time? And instead of just providing details about the applicant's life, the questions laid out in the template are really designed to provide that context. So you had this experience in your life. How did it affect your diagnoses, or how did your diagnoses affect this scenario in your life? And how does it relate to your ability to function and to work? We are certainly not expecting you to sit down with your applicant and go through the MSR interview guide and template with them. But as SOAR trained providers, we want you to become familiar with the template so that as you're engaging with the applicant over time and as you're working with them to learn about their life and tell their story, you're able to pull out certain pieces that will be really impactful for the medical summary report overall. All right, so what is, so a couple strategies for organizing the MSR. Organization is key because you have a lot of information that you are taking and you are condensing it into this document that you're going to share with SSA and DDS. So in order to write the MSR, you need to have medical records. So a critical component of the SOAR process is to collect all of the applicant's medical records. So you will do that with appropriate releases. And then once you have those, begin to go through the medical records and organize them in chronological order. Because while the MSR really does tell the story of the applicant's life, it's also going to speak to their medical treatment, both physical and mental health, and talk about how that treatment has affected their ability to function. The MSR is going to take time. So make sure that you're setting aside time to really write the MSR with no interruptions. But also don't wait till the end. Some of us might like that pressure of waiting till the end to write the full medical summary report. But if you can write chunks of it over time, that is going to be the best. So if you sit down with an applicant and you on that day talk with them about their interactions with the legal system, perhaps go back and then write that legal history section of your medical summary report. All right, so what are the sections that are included in the MSR? So the MSR is really thorough. So we're going to start off with that reference section and introduce the applicant. We're going to have a really robust personal history section that talks not only about the applicant's life experiences, history of homelessness, but also their educational and legal experiences. The occupational history section is one of the biggest and most important sections of the medical summary report because, of course, we are trying to answer the question, can the applicant work and earn SGA? So that question is going to be vital to answering that. If the applicant has a substance use disorder or history, the substance use section is going to be key to showing that the use is not material to the applicant's disability. Then we have our really comprehensive physical and mental health sections, which are going to discuss how do we make sure that the medical records and evidence that we're providing are meeting or equaling the SSA Blue Book listings. And then, of course, our functional area where we are going to document in detail the 4 areas of functioning. This functional information section is 50% of the disability determination. So it is so important to have a really robust functional history section, or functional information section rather, and talk about how the applicant's diagnoses affect their ability to function and therefore their ability to work. So another thing we really want to make sure that we are doing when we are writing our medical summary report is using respectful and person-centered language. And we have a brand new resource from the SOAR TA Center entitled Demonstrating SOAR Values with Our Words, Respectful and First-Person Medical Summary Reports. So we always want to come at this from again, a first-person perspective. So addressing the applicant by their name, John Smith, Mr. Smith, applicant or participant, as opposed to client or consumer. We never want to label someone as their diagnosis. So we don't want to say they are a schizophrenic, but rather a person who has been diagnosed with schizophrenia. Similarly, a person experiencing or at risk of homelessness rather than a homeless person, and so on and so forth. So this is a really great resource. Really encourage you to take a look at it and share it with your wider community. All right, and finally, we have a ton of resources from the SOAR TA Center designed to help you write your medical summary reports. So as mentioned before, we have the MSR interview guide and template. We also have a number of sample medical summary reports that actually come from the field. They're redacted, but these were medical summary reports for applicants that were approved. So we have organized these by the individual's disability. So this can be a great primer if you're working with someone who has this diagnosis as to what they're looking for in a good medical summary report. We also have sample functional descriptions because, as we mentioned before, the functional information section needs to be really detailed, and it's one of the most important sections of the MSR. And of course, your SOAR TA Center liaison is a key resource as you're beginning to write your MSRs. And even if you're a seasoned SOAR caseworker and have done many in the past, we can definitely feel free to reach out to us, and we can review redacted medical summary reports prior to submission. Keep in mind, they do need to be redacted, so all that personally identifiable information taken out. And we also really request that you seek support from your supervisor and other colleagues to proofread the MSR. You have been working on this document, this medical summary report, for a long time. So it's always really important and beneficial to get that second set of eyes on the document. All right, and with that, I'm going to hand it off to Dazara, who's going to talk to us a little bit about diversity, equity, and inclusion considerations for the medical summary report. Daz?
All right, thank you so much, Abby. I'm going to continue on with some information about DEI and our integration into the MSR, and also follow up with some resources, additional resources in addition to what Abby just described. So we have taken a lot of time at the SOAR TA Center kind of thinking about the model and how DEI can be infused in the work that we do. And one of the ways that we thought about was how MSRs are written. So Abby just did an excellent job of explaining what an MSR was, why it's important to write, but how we write them is just as important as just writing them, right? Including all that information can be really, really challenging for some folks when they're just starting. But how we write an MSR is really important in order to promote that respectful language that Abby was just talking about, to encourage information to come as quickly as we can in a way that we are able to gain that information through the care and how we express that applicant's individualized experience. And so SOAR providers have to consider the impact of what implicit bias can look like and how it can contribute to the disparities in not only how SOAR services are delivered, but how we write our MSRs. And from all of our discussions and our integration of DEI within our work, it's important to consider because it promotes equity and accessibility for our services. And being able to get that information quickly builds trust and rapport with the applicant. And it's necessary to gain that information so that we can complete these applications as thoroughly as possible. It also reduces the opportunity for implicit bias to kind of leak in your MSR and be impacted by the reader. One of these tools that we've created was a SOAR for Everyone. It's an infographic that really takes into consideration all the unique experiences of all the folks that we provide services for. So this is a really great one-page resource that could be used in your meetings and your in discussions with talking to potential funding partners. And it could also be used to attract potential funding partners that you haven't even considered before. So this is just a wonderful resource to help remind you of that. But getting right back to the MSR, reducing implicit bias in the MSR is really critical. And we find that stereotypical language and biased language is often found in the demographics and the legal history and the substance use history. We really encourage you to look at these resources and consider how your language could impact negatively the applicant that you're serving. So including information that helps provide insight into the applicant's current functioning is the goal, is the key. But removing any objective language, any information that can be considered as opinions is really what we encourage you to leave out of an MSR. And like I said, we find that these kind of disparities are often found in the sections of the demographics, substance use, and legal histories. We created a DEI implementation toolkit as another resource to consider how implicit bias contribute to the disparities in how SOAR services are not only accessed, but delivered to diverse populations. And in that, the toolkit includes tons of guidance and a huge section with information specific to MSRs. One of these kind of sections involve, I'm trying to think if I skipped a slide. So one of these resources that we have is a tool that is often used in trainings, and it's a tool that is an activity that discusses the ineffective and, well, it starts off with a discussion about the ineffective descriptions of MSR writing. And then it provides guidance on why that language is particularly ineffective and why it should be considered for change. And then it offers an effective description of that same paragraph. And so you'll be able to look at this and see, and see how the differences and how more impactful with the use of effective information and effective language can be in dismantling any biased opinions or objective thoughts or anything that could be hurtful to the applicant as we gather this information. It's a really great tool for improving your MSRs with respectful, person-centered language. And I really encourage everyone on the call to look at that, those resources. But in short, we work with a variety of diverse populations, and not everyone that we work with is going to have the same similar backgrounds or beliefs as we do. So it's important to share that individual story in a way that's respectful and really says, and really displays that applicant's experience in a way that can really focus on how this individual is struggling to function and maintain themselves at SGA in a work environment or in the community. And being able to do that takes practice, and being able to do that often will, help you to write more effective MSRs and project the less likelihood that the MSRs could be interpreted differently by the reader. So we really encourage you to write what you see, write what you hear, use quotes to capture the information that's shared by the applicant. And so that when we use those quotes, it can't be interpreted that we've taken information and interpret it the way that we want it to. The reader knows that those words are from the applicant themselves, and writing it exactly the way that they do without claiming that they are stating something. Just write what they say, And so with doing all of those kind of practices and those exercises, it brings way for more effective MSR that is really respectful to the applicant's experience. And with that, I'll go ahead and hand it over to Amanda.
Thank you, Desiree. Hello,
You're welcome.
everyone. I am Amanda Starkey from the SAMHSA SOAR Technical Assistance Center, and I'm going to present on how we can have a better understanding of SSA's definition of disability and use that as our guide as we write every section of the medical summary report. So a little background, I started providing SOAR services at a community mental health center in 2010. I've written a couple hundred MSRs in my career, and I've reviewed probably close to 1,500 or 2,000 MSRs at the SAMHSA TA Center. So I have a lot of experience writing and reading MSRs, and throughout my career, I have discovered some tricks and tips, and that's what I want to share on my portion of our presentation today. So I have a few objectives, and we're going to go back to the basics of SSA disability criteria and just provide a really clear definition of SSA's definition of disability. Then we're going to look back at Social Security's listings for mental health conditions, just to clarify what you should be looking for when and what it means to meet or equal a listing. We're going to talk a little bit about materiality, which is a really important phrase when you're working with someone with a co-occurring substance use disorder, because your goal needs to be to show that this person's substance use is not the cause of their disability, that even outside of their substance use disorder, they still experience severe symptoms and functional limitations from their mental health or physical health conditions. And then once we get all of that groundwork done, we're going to go through each section of the medical summary report and review ways you can think about all of the information as far as the definition of disability, the criteria to meet or equal a mental health listing, with keeping the materiality definition in mind when you're writing each section of the medical summary report. So we'll start with SSA's definition of disability. So this is the general definition in order to qualify for the disability programs under Social Security, SSI, and SSDI. And that is the inability to engage in any substantial gainful activity. That means work that would earn the applicant over $1,550 per month in 2024. So inability to engage in work that earns over that gross amount per month by reason of any medically determinable physical or mental impairment. Medically determinable means that it needs to be a diagnosis made by an acceptable medical source. And that impairment is expected to result in death or has lasted or can be expected to last for not less than 12 months. So taking all of those bullet points as a whole, so we need to show that because someone has a medically determinable physical or mental health impairment, they're unable to earn over $1,550 gross income per month, and that situation is either expected to result in death or it's going to last or has lasted for at least a year. So that's Social Security's most general definition. So when you're thinking about who may be eligible for SOAR assistance, that is the group of people that you want to have in mind. People that aren't going to be able to work for the foreseeable future, over $1,550 per month, and that has an impairment that can be diagnosed by a medical provider. So beyond the general definition of disability, SSA has specific criteria for each type of condition a person can have, and that is the listing of impairments. So it's an actual list of disabling impairments, and it's organized by body system. And for each category of impairment, Social Security has written out the specific criteria under which applicants who experience those symptoms may qualify medically for Social Security benefits. So they have a checklist that tells you exactly which symptoms need to be documented in order to meet the first part of the definition that they have a medically determinable impairment. They're important because they're your roadmap. They tell you exactly the signs and symptoms that an applicant needs to experience in order to qualify for benefits. So they tell you exactly what you should be documenting in your medical summary report. So you should be using the listings with every application that you submit. The first thing I do when I'm working with an applicant, after I find out what their conditions are, I go back and I print out the listing for each of those conditions and I put it in their case file. And I refer back to them often. When their medical records come in, I cross-reference the medical records with the listings that they're applying under, so that I can make sure that I am able to show documentation of their impairments. And then if I don't have that documentation in the medical records, I try to arrange evaluations or think about times when I've observed the symptoms that are in the listings, so I can add that information into my medical summary report. So the listings are organized by body system. This is a screenshot from Social Security's website, and it shows you how the listings are organized on their website. So one is musculoskeletal, and area 12 is mental disorders, and that's what we're really going to focus on in this webinar, is documenting mental health impairments with applicants. When we think about mental health disorders for that category in the listings, each listing is broken into 3 sections. They're called paragraph A, paragraph B, and paragraph C. Paragraph A looks at the medical criteria that must be present in the medical evidence. So the first part, paragraph A, is going to look at the symptoms that are documented in medical records. Paragraph B focuses on the functional criteria. It's assessed on a 5-point scale, starting with none or no functional impairment to extreme, where the applicant is absolutely not able to function at all in that area. And then paragraph C looks at the seriousness and the persistence of mental health disorders, showing that despite ongoing treatment, that they haven't improved over time. When we're writing our medical summary reports, we're really trying to focus on showing that the applicant meets the criteria for paragraph A and paragraph B of the listing. So I pulled a screenshot from the specific listing for schizophrenia spectrum disorders to break down paragraph A and paragraph B. So this is the legal criteria that we need to prove in order to help someone be approved for benefits, to show that they're eligible for the disability program. So it's important to read the listings carefully. So paragraph A focuses on the symptoms, not the diagnosis. If you'll see, it says, in order to meet the listing for schizophrenia spectrum and other psychotic disorders, it's satisfied by A and B or A and C. So A is the first thing we need to satisfy in order to meet the listing criteria. A says medical documentation of one or more of the following: delusions or hallucinations, disorganized thinking, or grossly disorganized behavior. So what we need to do to meet that listing is be able to show by citing treatment records because it has to be medical documentation. It needs to come from the medical records that a person is experiencing these symptoms if we're going to list schizophrenia or a related psychotic disorder as one of their disabling conditions. That's the first goal. We need to show that they meet paragraph A. And we also need to show that their conditions meet paragraph B of the listing. So in order to meet paragraph B, we need to clearly lay out the impact the symptoms have on an applicant's functioning. The language for paragraph B is extreme limitation of one or marked limitation of two of the following areas of mental functioning: understand, remember, or apply information, interact with others, concentrate, persist, or maintain pace, and adapt or manage oneself. If an applicant is not functioning at all in one of those areas, they may meet the extreme limitation. Our goal when we're writing MSRs generally is to show that they have at least a marked limitation in two areas of functioning. And how we do this is, and we're going to talk about this more as we get to that section in the presentation, but what we need to show is because of the symptoms we documented to meet paragraph A of the listing, they are experiencing these functional limitations. And this is what we need to keep in mind when we're writing our MSRs. The general definition of disability, but also being able to meet the specific criteria requirements in the listings for the conditions the applicants we're serving are experiencing. All right. So we talked about the definition of disability. We talked about how to read the listings and understand what criteria we need to get at in our MSRs. Now we need to talk about materiality. When we're working with people who have a co-occurring substance use disorder, it's really important to understand that SSA will not consider someone disabled. They will not be eligible for benefits if the disability examiner reaches the conclusion that the substance use is a contributing factor to their disability. We have to be able to show that the evidence supports that the applicant still meets SSA's definition of disability when drugs or alcohol use is taken out of consideration. So I have a link to SSA's Code of Federal Regulations on materiality and substance use that we will share in the chat. But this is just really good background information to know, and it's good to understand this, and this is why you should always have a substance use history section in your medical summary report and be very thorough when addressing it for any applicants with a history of substance use or ongoing co-occurring substance use disorders. Okay, so now that we got the basic definitions out of the way and you know what your goals are for writing an MSR, it's to show that an applicant meets the general definition of disability, they have an impairment that's going to last at least 12 months, and that impairment will prevent them from earning over $1,550 per month gross income. We need to show that the symptoms that they're experiencing are severe enough to meet the listing criteria. And we also need to show that their substance use isn't a material cause of their disability. So we're going to break the MSR into each of the major sections and talk about how we can think about those definitions and those three goals we have when we're writing each section of the MSR. My hope is that when you have this information, it'll save you a lot of time with MSR writing because your goals will be much more targeted for each section. Hopefully it will make your MSRs more concise, but also more impactful. So we'll start with the introduction. Obviously, the first sentence of the introduction should be to introduce the applicant and just provide some general background information about why they're applying for benefits. The next part of the introduction needs to list all physical and mental health impairments. if you're going to discuss something in later parts of the MSR, like the physical health or mental health treatment sections, they need to be listed in the introduction so that the DDS examiner who will be reviewing the report can keep these conditions in mind and keep the listing criteria for these conditions in mind as they read the rest of the report. So it's really important to include all physical and mental health diagnoses, even if they haven't been confirmed. If you are going to talk about symptoms that the applicant experiences in the MSR, if they haven't had a lot of treatment for those symptoms, you should still list it in the introduction so that DDS can think about that listing and maybe schedule a consultative exam for the applicant so that they can get some medical evidence about the condition. You really want to keep paragraph A of the listing criteria in mind when you're describing the applicant's behavior and presentation in the introduction. You want to be able to help the reader visualize the applicant's symptoms. Let's think back to the schizophrenia related disorder listing that I shared a couple slides back. So the listing criteria for paragraph A was that they need to have experience delusional thinking, or grossly disorganized thought, or oh my gosh, I'm blanking on the second one. Anyway, we'll think about those two things. When you're working with an applicant in the introduction, think about creative ways where you can present those symptoms. So during any of your interactions with the applicant, did you observe them experiencing paranoid thoughts or delusions or experiencing psychosis? What did that look like? The DDS examiner is never going to get to meet the applicant. So this is your chance to paint that picture of what the applicant looks like so they can start visualizing, oh, okay, I get it. I get why they're applying, because I can picture that time that they described in the introduction about when they were experiencing some delusional thoughts. My last piece of advice for the introduction is to end on a strong quote from the applicant about why they feel they're at a point in their life where they need to apply for disability records. A lot of times I ask the applicant, if you could say 1 or 2 sentences to the person who's making the determination on your case, what would you say about why it's important for you to be applying for these records right now? And I usually use that as the last sentence of my introduction as an opportunity for the applicant to tell their own story and to really make a strong impact with the DDS examiner. For the personal history section, so this is going to cover the applicant's childhood, any of their trauma history, their education history, and their legal history. We have some overarching goals that you should focus on during this time. First is to provide a historical context of the symptoms. So again, keeping the listing criteria in mind. If we can show that when the symptoms first started, was there an event that led to the first experience of symptoms? Then that should be where you start your personal history section so that the reader can understand, okay, this is the role that the symptoms played in that applicant's life, and then go on to provide more information and background about their personal history so that the reader can have a better understanding of how their life events and possible trauma history has played into their experience of symptoms as their life went on. We want to present it in chronological order. Discuss the trauma as it relates to symptom onset and progression of symptoms. Illustrate early symptoms. A lot of times symptoms started in childhood for people, but they didn't receive treatment at that time, but they can still tell you about how they felt and how those feelings impacted their social interactions from a young age. And we know that things are kind of a butterfly, ripple effect. So those symptoms that they felt in childhood weren't just in a vacuum, that continues to impact someone throughout their life. So our goal is to set the stage and provide the context that's going to help the examiner better understand why they are experiencing symptoms at the level they are today. So things to think about when you're writing your personal history sections of the MSR. What role did family dynamics play in the progression of symptoms? How did symptoms impact the applicant's experiences in school, socially and academically? What is the ongoing impact of symptoms on the applicant's life and living arrangement? So when we think about writing these sections with meeting the listings in mind, you'll be able to focus on always describing how symptoms have played a role in the development of someone's life. The next section we'll talk about is work history. So this is one of the most important sections of the MSR, because again, when we're thinking about the definition of disability, it's to show that the symptoms they're experiencing are preventing them from earning substantial gainful activity. So what symptoms did the applicant experience at work? When they experienced those symptoms, how did it impact their functioning at work? And can you provide any specific examples of this? And one way to do that is to reach out to current or former supervisors. They often have a lot of insight on why a job might not have worked out for an applicant, extra considerations they might have needed in a work setting, or why their hours may have needed to be reduced. It's really helpful to ask that former supervisor if it's a possibility. They could write a letter of support, and we're going to share a sample of that later in this presentation. It's also helpful to compare the employer perspective with the applicant's perspective. So for some applicants that I've worked with, their perspective was that they did really well in work, but their employers just didn't understand them, or they didn't see the vision that former employee had. So it's helpful to say, okay, this is what they say about their work history. This is what their employer says, so that DDS has the information to show that maybe there's a lapse in understanding or remembering if they're not remembering their work experiences comparably to the employer's memory of it. Or maybe they weren't understanding what was actually expected of them in a work setting compared to what the expectations were from the employer. So again, that's starting to think with the meeting the listing criteria in mind. Like, we're starting to think about that understand, remember, information functional section. When you move on to the physical and mental health treatment sections of the report, you want to make sure your treatment history is clad with the right information. And I made up that acronym when I was writing this slide. So it's new, but it just means that you want to make sure that it's going to be sturdy and making a strong argument to show that the applicant's conditions meet the listing criteria. And the C in that is to cite the treatment records whenever possible, keeping the listing criteria in mind, and the definition of disability. The applicant needs to have a medically determinable impairment, and there needs to be medical documentation of their symptoms. That's paragraph A of all of the mental health listings. So citing the treatment records to show this is when they received treatment, these are the symptoms that the provider observed. You need to be able to do this to show that they meet the listing criteria. The L in CLAD is the listing criteria should always guide your writing. So like Abby said, organizing the treatment records in chronological order and keeping the listings in mind, going through those treatment records and putting sticky notes next to anything that lines up with the listing criteria is a really great way to organize your work so that when you're writing this section of the MSR, you can go back and give a chronological progression of their symptoms and be able to back up all of your statements with citations from the treatment records. We want to avoid lists. You don't need to keep listing all of the applicant's conditions or every single time they ever saw a doctor. Those lists aren't helpful. It's the information that's in the treatment records that DDS needs to clearly understand. So the actual diagnoses an applicant has are not what meets the listing criteria. It's the documentation of the severity of their symptoms that does. And that's why you need to provide full quotes from the records and not just list every diagnosis they received. You need to provide the information that shows why they received those diagnoses, what symptoms were observed that led the psychiatrist or the psychologist to make that diagnosis, by documenting the severity of symptoms. All right, the substance use history section of the MSR. So keeping the definition of disability in mind and also that definition of materiality. So it's important to understand the context of the applicant's mental health symptoms and how they played into their early and continuing substance use. I break my substance use history sections into 2 paragraphs. The first is to lay out the history of the use and the progression of the use over time. So what was going on when they first started using substances? A lot of times you'll find it happened shortly after a traumatic event, or if they had a lot of trauma in their childhood, and then they were exposed to drugs or alcohol in their adolescence, and they started using then. Talk about how that affected them. What was the result of them using substances at a young age, or even at any age when they first started using, and how did that lead to a progression in use? If they're currently using, end the first paragraph of the substance use history section with why. Are they using to help tame some of the symptoms they're experiencing? What impact do they see the substance use having on their life today? So once you lay out the reasons for use and the history and progression of someone's use over time, then you need to dig into the materiality piece with the definition of materiality for people with co-occurring disorders. In order to show that someone's substance use is not material to their disability, we need to show documentation of symptoms during periods of non-use. If you have treatment records that document negative drug or alcohol urine screens, those are really helpful to include, but you can't just leave it there and say they had negative toxicology screens during this time period. You need to take it a step further and be able to explain their continued symptoms, or even a lot of times the worsening of symptoms during that period of documented non-use. The next area of the MSR are the functional information sections. So you'll want to include at least one strong paragraph for each area of mental functioning. And your goal here is to link the symptoms to functioning. Your first objective when you're writing a functional description is to describe the symptoms an applicant experiences so that The DDS examiner understands what symptoms they have, and then follow that with details about how those symptoms have led to functional impairments. So you can't just talk about the symptoms they experience, and you can't just talk about their functional impairments. You need to talk about the synergy of what happens when those symptoms lead to the functional impairments by using specific examples and direct observations. So you don't want to use general descriptions like, Mr. Smith doesn't like going out into public. That doesn't provide any information about how Mr. Smith's symptoms are affecting his ability to go out in public. Instead, you want to provide specific examples. When Mr. Smith needed to go to an appointment with this caseworker, he was experiencing a lot of anxiety. He said he felt like his heart was racing. And in the end, he didn't make it to the appointment because he said he couldn't leave his house. He said his hands were really sweaty and cold. He was very shaky, and he felt much too nervous to leave his house because he thought that people were going to follow him here, and it made him really uncomfortable. So that is a really strong example and a detailed example of how someone's symptoms impacted their ability to interact. Quotes from the applicant and people that know the applicant are invaluable for functional descriptions because they can provide really concrete examples about how symptoms are impacting functioning. And then finally, the summary. So in the summary, we do not want to present any new information. This is just tying things up nicely and leaving the DDS examiner with just a nice 5 to 7 sentences that tie everything together. You'll want to start the summary paragraph by restating all diagnoses, summarize some of the key points from the body of the MSR. I like to end mine with a poignant observation of the impact the symptoms have had on the applicant's life. So for example, if someone was experiencing bipolar disorder and having manic and depressed episodes, I would talk about how when they are experiencing a manic episode, they are unable to interact with people because, explain why. When they're experiencing an episode of depression, they don't leave the house, and they even have a hard time just getting out of bed and getting dressed for days at a time. So that the DDS examiner can have one final reminder about the why of why this person is applying for benefits. And as always, include a signature line for yourself as the SOAR caseworker and the acceptable medical source, because like Abby said, once it's signed by an acceptable medical source, it's elevated to official medical evidence in the applicant's case file. All right, I think Pam's coming back.
Thanks so much, Amanda, for all of your tips and strategies and sharing a new term. I'm glad that hopefully everyone will start using as you build your medical summary reports. Now we're going to move into a section where the TA Center staff is going to answer some of those questions that we receive frequently that will help inform your webinars, your MSRs. So we're going to start with Kristen, I believe, who is going to take the first question.
All right, thanks so much, Pam. So we often get a question when folks are documenting occupational employment or work history, and they say, what do we do? How do we document work that was not on the books? Or some people will say work that was under the table. And our recommendation is to definitely cover that information in the medical summary report in the occupational history section. So use the clip on the screen here is of the interview guide, and use some of the questions and talk to the individual about the work that they were doing, whether it was, on the books with an employer or not. You can describe it, as you would describe self-employment, right? The person is functioning at some capacity and they are attempting to work, attempting to earn income that they need to survive. And what are they doing? And how are they struggling with that? What parts of their illnesses, what parts of their symptoms are impacting their ability to do this work and these tasks, and what did they struggle with, and how long were they able to do it. And you can use this as an opportunity to just more fully describe how they function and how they function in a work environment, even if it wasn't with a formal employer. So go ahead and describe that work as best you can in that medical summary report.
Thanks, Kristen. So I'm going to take the next question. In fact, we had this question in a couple of different forms on today's webinar, having to do with, should we work with applicants who just present with physical impairments? And absolutely yes. So as Amanda talked about, step 3, utilizing the listings of impairments. There are some folks that may not quite meet a listing, but at step 5, where Social Security may apply what they call the grid rules, an individual who presents with more physical impairments that cause exertional limitations that are severe, which means, sitting, standing, walking, lifting, carrying, like those types of exertional limitations. A person may be awarded given certain vocational profiles, such as age, education, and the prior work that they did. So we have a link to the grid rules. This is where you'll get the most up-to-date grid rules. The screenshot is a bit outdated, but it still gives you an idea of how Social Security does assess a person's RFC, or residual functional capacity, in terms of, the type of work that they can do given their age and past work. Can they do more sedentary work, or light work, or median work? So then, as you can see, this is kind of like a mechanical framework where Social Security will plug in certain of these vocational factors like age, education, and the type of work they did. Was it unskilled, semi-skilled, skilled? And then the final column would be, does it direct a finding of disabled or not disabled? So that, again, is the second place where an individual could be awarded benefits. So again, we really, all of this to say, keep the grid rules in mind when you have applicants that, while it applies to applicants of all ages, it's really most useful for applicants who are 50 or older with more physical impairments. So keep that in mind, and you certainly want to utilize what Amanda said in the MSR. In the introduction, we'll have the applicant's age, education, and the prior work that they did. And then your employment section and the physical history section will be very important for Social Security then to apply the appropriate grid rule. So there's nothing you need to do other than get that information into the MSR so that, again, Social Security can more easily utilize, one of these rules to hopefully award the applicant, again, with more physical impairments. And we're moving to question 3.
All right. Thanks, Pam. So we've actually been getting a lot of questions in the chat about this very question. So who can co-sign the medical summary report, and what are some best practices for gaining buy-in from acceptable medical sources? So I'm adding to the chat Social Security's list of acceptable medical sources. And essentially, these medical providers are going to be physicians, psychologists, advanced nurse practitioners or physician's assistants, audiologists, some types of pathologists, midwives. So Social Security has a very specific list as to who can sign the medical summary report. And then that information is going to be elevated and weighted more heavily, and it will be considered medical evidence. However, if you cannot get the MSR signed, that is still okay. And while our hope is to have it signed, it is still really critical collateral information when it's not signed. A couple of resources that we have that we recommend you looking at is the acceptable medical source link, as well as a what medical providers need to know. A couple folks in the chat have said, I've had really hard times getting medical providers to sign off on MSRs. What's some of your advice? And my advice is to be persistent. Talk with perhaps the office manager, the nurse, the acceptable medical source about why this is important, and explain that the writing, what you are including in the MSR, is based off of the medical records that they provide. If they're not able or they're unwilling to sign the MSR, see if they would be willing to write a separate letter that speaks to the applicant's functioning. And you can provide that functional piece from that MSR interview guide and template. So the more you can get the acceptable medical sources involved, the better. You won't necessarily always be successful, but in our mind, in our experience, persistence in that.
All right, another question we get is, what if the applicant's perceptions don't align with information from treatment providers and support people? So I actually addressed this a little bit when I was talking about work history, but I try to keep the perspective that every roadblock with the application process when working with an applicant is an opportunity to document functioning. So if the applicant remembers something completely differently from a family member or their past employer or a treatment provider, it's helpful to document that and describe what the discrepancies are in their memory in the functional information section. These could be great examples of their struggles with understanding and remembering information. And this goes for other roadblocks too. If someone is having a hard time engaging in services, or they're not open to sharing a lot of information, I saw some questions about that come through in the Q&A. You can discuss that. You can discuss that they're uncomfortable and they have a really hard time sharing information, or they shut down when a certain topic was brought up. That's documentation of their symptoms and their functioning. So anytime you run into a roadblock, use that as an opportunity to discuss in your medical summary report the symptoms that the applicant was experiencing and your observations of their functioning.
All right, how can I document functional limitations when the applicant is in a controlled environment? And this question comes up a lot as well. And it's usually from folks that are working with individuals that are in jails or prisons or even hospital stays. When we are talking about controlled environments, most people are referring to jails or prisons though. When we're working with those individuals, it's important to remember that jail and prison are still community. The same way that individuals struggle in community is the same way that they struggle behind bars and while incarcerated and living under that structure. So if we were working with an individual in the community, we would talk to service providers, anyone that can have, that has any access to this individual, whether it be family members or past case managers, anyone that has interaction, right? And we would get information about, as much information we could about their past and how their past trauma have impacted the way that they function currently. And we would do the same thing for individuals that are incarcerated. If they're in a system of care where they are not free to leave, then we would talk to the same community members. We would talk to the folks that they see, whether it be their social workers or caseworkers there. We would talk to, oftentimes in that situation, talking to guards are really, really important. Oftentimes we have individuals that project one way when staff that work 9 to 5 are there. But the real truth of their struggle might come out after everyone like that leaves. And they go to their respective homes and that person is left in their home. And they might depend on a cellmate to tell them when to take their medication. Or they might depend on someone to encourage them to go shower. And if they didn't have those kinds of supports, We'd see them as support in community. We have to see them as support in this environment too, because if they didn't have support, they would likely have some other adverse consequence. When working with individuals that are incarcerated, it's important to look at not only their medical file, but their institutional file as well. Most prisons and jails keep those separate. An institutional file contains information about disciplinary actions, any kind of behavior that could be considered disciplinary, and they might not have done a formal disciplinary report, but oftentimes a struggle to function in controlled environments look like disobedience, and they often result in disciplinary action. So looking at those looking not only at the medical records, but looking at the institutional file, you may have to request those in addition. So when you write medical records, when you're doing your request from the jail or the prison and you're writing what you'd like to see, put institutional file down as well. So you would put medical information and institutional file. And those are not always that easy. No medical records from a prison or jail are easy to get, but I would encourage you to stay persistent and consider the environment that the person is in as part of community. I think you have the next question, Kristen.
Kristen, you're muted. Kristen, you're muted.
All right. Sorry about that. Thank you. We've got lots of hands on deck here. So this question is about the best way to communicate with employers to get collateral information. So we've talked a lot about ways that we can add additional details and examples of how individuals are functioning, and how individuals have functioned at work or struggled at work can be really essential to document and provide to the DDS examiner. So when you want to speak with an employer about someone's either past or current work, if they're still working there, but only able to work a little bit or under SGA, get a release from the applicant first to make sure that you have permission to, speak to the employer about their work or speak to them with them present, and visit in person if you can. Those conversations are definitely the easiest to have. If you're able to go there, if it is in your local community, go so you can have a direct conversation, or call their former supervisor and talk to them about how information from them can be helpful to document the impairments that the person had, any struggles that they had at work, any things that the employer did to help make it easier for the person to keep their job. So there are things sometimes when you have a really, I call them benevolent employers, but you just have a really nice supervisor who gives people second chances or gives them extra help or reduces their workload or changes their tasks based on struggles that they might be having related to their illness or impairment. And you want to document all of those things. So what is it about the person's job that was changed because of their illness? Or what exceptions did they make? Or allowances did they make? Or other accommodations did they make? Like, what was that like? How did they perform as it related to other people who were in that same position? And did their illness impact their ability to work at that same level or that same rate or at that same task? And as much as you can get in quotes is great. If they're willing to write a letter, fantastic. If they don't have time for that, but they're willing to have the conversation, you take down those notes and you can add them into your medical summary report. So again, asking for a release, asking questions in person if you can, or over the phone to just gather as much information as you can about what the work scenarios were, what those accommodations might have been.
All right, and our last question is, what should I do if the applicant I'm working with currently uses drugs or alcohol? So I saw a question specifically related to prescribed marijuana use. In states where marijuana is prescribed, it's just like any other medication. It's a prescribed treatment. So what you would want to document is the reasons why it was prescribed and the side effects that the applicant experiences as a result of taking that prescribed medication. So DDS will understand maybe if they are using marijuana for medical purposes, that they experience trouble focusing or sleepiness when they take it. So that will come into consideration as part of their functional limitations and their symptoms when DDS is making their decision. When you're thinking about someone who is currently using drugs or alcohol while applying for benefits, what we need to really focus on is documenting what it looks like when they're not using drugs or alcohol. If you don't have medical documentation of this, if you do have medical documentation of that, definitely address that in your medical summary report. But if you do not, you can still talk about this with the applicant and use their quotes from what they've observed. Or if you have a release signed for a support person, a friend or a family member, they can tell you about what they observed about the applicant's experience of symptoms during periods when they weren't using drugs or alcohol. Another good place to look for these records is incarceration records, hospitalizations, when they did not have access to drugs or alcohol. If you would like to see more information about documenting substance use with co-occurring disorders, you can check out the YouTube video that we have linked for this slide, along with the world's worst illustration of me as I narrate it.
Okay. So now we're going to open it up to general questions from participants. We have already at the TU Center answered over 50 questions that have come through, 50 questions related to Social Security and SOAR and MSRs and everything in between. So we just wanted to give you an opportunity. If you haven't already, you can put a question in the Q&A feature. And we're not going to get to all of them, but after the webinar, we'll be able to get responses afterwards. So we have time, about 15 minutes or so, to take some more questions. And a couple came in about who is really able to write an MSR. Must they be SOAR certified or just be educated about it? So who would like to take that question?
I can grab that one. So we definitely want people who are submitting SOAR-assisted Social Security disability claims to be SOAR certified. There's so much that you learn in the SOAR online course through completing the practice case component, from getting feedback on your practice MSR, and learning that happens in that process. So everyone who is assisting with and submitting applications, writing a medical summary report, we do want you to fully complete the SOAR training and receive that certificate of completion. However, anyone can do that, right? So there is no educational requirement or experiential requirement in order to assist individuals with SOAR-assisted disability applications. What's required? A passion and commitment. You have to, want to work through this process that you all hear from these conversations. It's complicated, it's time consuming, but it is so worth the effort. And so if you have that commitment and you can make the time to really gather the evidence, get to know the applicant, document their disability, write that up for their application in the MSR, then fantastic. And so we have people who have, no further education beyond their high school experience and have a whole heck of a lot of lived expertise that they're putting into this, doing incredible SOAR work. We have folks with master's degrees and law degrees who do it too. It's just a whole gamut of people who really want to help folks through this process and get them approved.
Thanks, Kristen. So completing the SOAR training is a must. So the next question, I'm sure we all have opinions on this at the TA Center, and it makes me sad. So hopefully we can switch, turn this stinking thinking around. I just spoke to a SOAR case manager who stopped doing MSRs. Doesn't sound okay, because each claim should come with a summary done, correct? Right? So who wants to talk about that, where they heard on the street that case managers or DDS are not accepting MSRs, or the case manager's just not writing them anymore, they stopped? How can we provide, how can we turn this around and try to get that case manager to continue to write these medical summary reports? How about you, Amanda?
All
How
right.
would you like to give advice on?
Yeah, so I'll start by
Yes.
saying the medical summary report is the hallmark of a SOAR assisted application. It is a critical component, and it is what sets a SOAR assisted application apart from just providing application assistance and helping someone fill out the forms. It provides all of the contextual details necessary for the DDS examiner to understand what was going on between the treatment episodes, or what was happening that was leading to treatment in the first place. What was going on at work that prevented the applicant from being able to earn over substantial gainful activity levels of earnings. So I can't comprehend how what the justification could be for submitting a SOAR application without an MSR. An application is not SOAR if it doesn't have an MSR. And bottom line, if you're submitting SOAR assisted applications and not including an MSR, they shouldn't have the name SOAR on them. They need to have a medical summary report.
And the webinar is really all about showing the importance of including an MSR as part of a completed application, right? Like Amanda said, it's not SOAR if it doesn't include that MSR. And if there's anything that we can do to help provide even more guidance on making the writing process easier, more efficient, if you can apply some of the tips that we shared on this webinar to really help you write one for your next SOAR claim, just do it. Like, go through the exercise of writing an MSR. And again, have us at the TA Center review your redacted MSR. Maybe somebody wants to talk a little bit more about how mechanically, a case manager can do that. Send us your draft MSR so that we can provide feedback. Who would like to take that? Abby? You review a lot of MSRs for your states.
Yeah, so we like to review MSRs. So please send them to us, like Pam mentioned, redacted. So what this means is that all of the personally identifiable information is going to be taken out. So name, date of birth, social security number, any names that aren't related to the applicant. You can use that control find or control replace, and you can make sure that they are all removed. And they need to be physically removed. They can't just be blacked out or physically taken kind of a marker over. The other thing that we really want to see when you do that is to send it to us in a Word document, because we are then able to put track changes in that Word document and send it back to you. It's also super helpful if you let us know your time frame. So, hey, I need to turn this in, in 2 days, 3 days, or I've got a little bit more time, so we really know a good time frame for that. But definitely recommend reaching out to your SOAR TA Center liaisons about their ability, or about reviewing the MSRs. And note too, if your liaison's on vacation for a week or they're out of the office, we have an entire team at the TA Center that can help support you.
Thanks, Abby. We love reviewing MSRs. It gives us an opportunity to see really what's going on, with your claim, and to really help you, make your MSR the best that it can be. And often you might go back to the applicant to clarify some information. You may go to, one of the applicant's family member or friend, or let's say a supportive housing case manager, and get that quote that's really needed to, help visualize this is how that individual is functioning currently. So again, doing that is wonderful, because then the case manager will send back an MSR that includes these quotes that we see may, make DDS, really apply a listing so that that person's awarded based on that functional information that's now included in an MSR that prior, maybe the case manager didn't think about it. So we really help them, think about some additional information that can be helpful. So don't be shy. We again enjoy reviewing those redacted MSRs and getting that feedback. Okay, so another question came in. So Amanda talked about like referencing the listing in the MSR, but the question was, what do you mean the listing should be referenced for every claim? Like literally, like write Miss Jones meets listing 12.04, and this goes to the grid rule. Like, should you write the grid rule? Like, how do you convey that without maybe literally listing that information? What is your recommendation? Maybe Amanda or others.
Yeah, so we don't want to literally write the listing or the grid rule in the MSR. The DDS examiner has lots of training and they're well aware of the listing criteria and they're well aware of the grid rules. What we need to do is present the evidence that supports that the applicant meets or equals that listing criteria or meets or equals the grid rules. So when I say reference the listing with every MSR, what I mean, and I hope it came across that way, is keep that criteria in mind and use it to guide your writing with the MSR. So your goal the whole time, every sentence you add into the MSR should be added with the purpose of this is going to help illustrate that the applicant's symptoms meet or equal a listing.
Great. So we're helping DDS connect the dots, with the MSR rather than, using the actual rule, the listing. So hopefully that clarifies that question. We're laying it all out there so Social Security can make their determination without telling them this is the listing, because as Amanda said, they're going to see it through your descriptions of the MSR.
So I'll also add with the, and that goes into the functional information descriptions as well. So you don't need to tell the DDS examiner in your report that the applicant experienced marked limitations in functioning in a specific area. Don't do that. That's their job, is to make that determination. What you want to focus on is providing the evidence they need to know in order to come to that conclusion. So provide as many examples and illustrate the links between how symptoms lead to functional impairment so that the DDS examiner can understand that, okay, yes, you're laying out really strong examples that this person is experiencing a marked limitation in functioning.
Great. So a question came in about the lack of medical records. And we know that writing medical summaries is an important section of the MSR. So sometimes I get applicants with no medical records and or with no recent ones within the last few years because they don't trust the system. Any suggestions for writing an MSR like this? So for applicants that it may be a factor of their disability is why they're not in treatment, or access, they don't have access to treatment. So what can you do to include that type of information in an MSR? Who would like to take that? We've all been there.
Yeah, I'll start and see if anyone else wants to add anything after this. But I would say that's sort of scenario is perfect for a SOAR trained practitioner, right? Because what we're doing is spending time with the applicant. We're observing them, we're talking to them, we're talking to collateral sources around them and trying to learn as much as we can about how their illnesses or conditions are currently impacting them, right? And so we're gathering that information, we're documenting it, we're writing it up so that we can describe why the person, like Pam was saying, hasn't been engaged in treatment, whether that's symptom related or access related, and getting as much documentation of
Yeah, I think that goes back to getting medical evidence, but also the applicants that, again, lack that evidence. So when we're reviewing MSRs, for case managers, and we see that, all right, there's not a lot of medical evidence there, but there are so many individuals in that person's life, like lay evidence, as Social Security calls it, maybe their friend or family member or supportive housing case manager. There's a lot of folks in their life who can provide that evidence of how that person is currently functioning, has been, functioning over time. And if you're lucky enough to be able to get the applicant's current treating physician, nurse practitioner, whoever is treating them, to sign off on that MSR, they're essentially attesting to this is how the person is functioning. This is how severe their impairments are. Even if there's only a consultative exam or 3 visits the person had recently, right? You might not have the 2 years of records. It's really how they're currently functioning. So again, this is where, sometimes we come back to the case managers and say, hey, try to go ask these folks. They're what they observe is really, really important. And DDS values that because it's coming from folks that know the person really well. So I think that's really important to do. Really enhances the MSRs.
I'll also add something that I kind of use as a guiding light with SOAR is and this goes back to DEI considerations as well, it's really a disservice if someone's lack of access to services also serves as their barrier to accessing Social Security benefits that they're eligible for. So what we can do in the MSR is, again, provide that context. If they didn't have access to treatment, or the symptoms they were experiencing are what prevented them from trusting and engaging in treatment, we have the opportunity to help them tell their story to the disability examiner. And that's the beauty of a medical summary report, is that we can talk about what was going on when they weren't receiving treatment, so the DDS examiner can understand the true impact of the symptoms on their life.
And I was just going to add that, Amanda, I think you might have mentioned this earlier before, but every interaction with a SOAR applicant is an opportunity to gain more information for the MSR, every single opportunity. So in Kristen's example, anytime, when someone doesn't have robust medical records, every interaction, every single quote that they have, every instance or dialogue should be written in a way that's so descriptive that DDS can see the person's limitations in the same way that you do. So, when we say it's 50% of the disability determination, process or recipe, then we have to make sure that we have everything that we can, so that when DDS reads it, they could see the person, they can hear almost their voice in their quotes when we're writing them, that they can understand that this person's, struggle to function is really related to the symptoms that they're experiencing. So just writing that they have a struggle and understanding with or remembering information, and that's it, without those kinds of very descriptive paragraphs or examples, it makes a world of difference when you use that kind of description in language, so that DDS can see, like really see what we're trying to describe in what we write.
Well, thanks for that. So with those closing comments, we are out of time. Between the questions we answered in the general session and then during the webinar, there were over 100 questions answered, believe it or not. So anything we didn't get to, we'll get to you over the course of the next week or so. So thank you again so much for joining this webinar. This is the last one for our fiscal year. We'll start up our next series, I believe, in October. So again, we encourage you to fill out the evaluation that you'll see when we close out the webinar. So we appreciate your feedback, for that too. So again, I just wanted to thank the TA Center staff and our ASL and closed captioners for your time today. And of course, please reach out to us to review your MSRs. We encourage you to write those MSRs, make them part of your completed SOAR assisted applications. And again, thanks again for your time today. We appreciate it. Thanks again.